This is Dr. Christopher Carrubba, one of the medical directors at TrueLearn, coming back to you guys for another Step 1 question breakdown. The goal for this question is to show you a couple things, but especially to focus on how you're going to approach questions with EKGs in them. As usual, we'll also talk about some test-taking skills that I like and that can help me with these specific types of questions, as well as several others that you're going to encounter. By learning this stuff, you're going to make it a lot easier for yourself and really help you stay calm when you see this type of content and do well with these types of questions. So as always, I kind of like to look down at the end of a question first, just to get a feel for where it's going. Looking at this, we know it's going to be cardiology. We also know that there's an EKG being shown to me here. So we know that's going to tie in as well. One thing that I like to try to do is think a little bit about what some answer choices might be, especially if they're not direct. Something like mitral stenosis or complete heart block is very direct, whereas accessory conduction pathway is obviously being used as a placeholder for something else. Now, why don't you stop for a second and try to think what that might be before I go ahead and give that away. So what I'm thinking here is that this would be Wolff Parkinson White Syndrome. So right away now, we kind of have our entire set of diagnoses that this could be. Another thing that I like to think about, especially when you are going to show me an EKG, is for any given answer choice, would there be an EKG to be shown? So obviously, Wolff Parkinson White has very characteristic EKG findings. Same things for complete heart block. However, if I'm looking down at some of these other things, mitral stenosis, while there are certainly going to be some things that a cardiologist would be able to see, maybe a little bit of left atrial dilation, or some characteristics like that, that would not be something that at the level of Step 1 or even Step 2, you would be expected to notice on an EKG, thereby making this kind of unlikely. Even with pulmonary hypertension, right axis deviation, right bundle branch block, maybe you might be expected to see that, again, a little bit less likely. And then with systemic hypertension, there certainly are some EKG findings that are there, but not really something that gets tested on Step 1 very much. So always try to keep that in mind, based on the level where you are, oftentimes images or answer choices can be eliminated just because you would not be expected to know that for your level of knowledge. But, let's get up in here now and see the rest of the question and we can go from there. So here we have a 46-year-old woman that's coming in because she's having, a little bit of exertional dyspnea, decreased exercise tolerance. We see that she has a fairly benign medical history, and nothing in here in review of symptoms that would be concerning for anything else. As we look through, we notice she certainly is tachycardic, otherwise fine. And then we're seeing our characteristic EKG here. So what do you do? So one thing I always like to point out is that reading an EKG on the test is much different compared to reading an EKG in real life. And the reason for that is when you're being asked in a clinical setting to read an EKG, you're really coming in with a blank slate. You have an endless amount of possibilities. And there's a lot of things you need to do. You need to check and see if there's a P wave with every QRS complex. You're looking at width. You're, really looking at a lot of details and considering a lot of things. But for the purpose of the test, the nicest thing is that your answer choices are really going to guide you as to what the possibilities are. So for me, what I like to try to do is I'm going to start really with, the contiguous lead, the long lead here at the bottom, and I'm going to ask myself, what do I know about each of these? What EKG findings would I expect? So I can go in and say, okay, for Wolff Parkinson White Syndrome, I would expect a shortened PR interval and a delta wave. And, here right away, we look up and we can actually see that there. But, going through the activity, you could again say, okay, for heart block, I would expect to see dissociation between the P waves and the QRS complexes. Clearly, I don't see that here. We've got a P wave followed by QRS, P, QRS, and we notice that across the board. Mitral stenosis, we established already that there probably aren't EKG findings with that. Pulmonary hypertension, again, you're not going to really be expected to notice, things like right atrial dilation at, your level. And, for systemic hypertension, same thing there. I don't really see anything that's telling me there's, left ventricular hypertrophy for this patient. And the other part here, though, we want to avoid just jumping to the answer and being done. We want to use the other details and make sure that the rest of this fits. And, we can go through and feel pretty good about this because this patient does have normal laboratory findings there. So that's one way to answer this question. And, we can click our answer and see that this is WPW. But one thing that I always like to highlight is that just because an image is there does not mean that you have to use the image to answer the question. And if you're in a situation where you don't understand what you're looking at, there's still usually ways that you can get this right. So for me, that means really thinking about the clinical picture of all of this. So for Wolff Parkinson White Syndrome, obviously there's nothing here that tells me that this can't be the right answer choice. There's no details that jump out and say it doesn't fit, mostly because it has a pretty non-specific presentation when you're thinking about that. But if we look at our other answer choices, complete heart block, what do we know about that? Well, usually that is a condition that's going to be giving me bradycardia. I don't see that here. I also don't see any reason why she would have complete heart block. So we can kind of move on from that, even if I don't know what the EKG is showing me. As far as mitral stenosis goes, we know that's usually somebody who has rheumatic heart disease. There's nothing here in the history that would be pointing me towards that. So again, we can kind of move on from that. In terms of pulmonary hypertension, first and foremost, why? Why would this patient have pulmonary hypertension? Doesn't make a lot of sense to me. And then again, like we said, we just know that's not something where at the level of step one, you're going to be asked to recognize that on EKG. And then as far as systemic hypertension goes, well, we can just outright look at the patient's blood pressure and we see she's not hypertensive. So that's probably not going to work in there as well. So lots of different ways you can always answer these questions correctly. And I think the best test takers really try to look at all sides of that because you never know, there's going to be times where you might think you understand what you're looking at, but then you get up into the text and, it feels a little bit different. And those can oftentimes be a way to catch yourself and realize that you might have made a mistake. So try these skills out, try taking advantage of the answer choices as you read your EKGs. And I think that's going to help you a lot as you progress through and, really help you do well. Thanks for tuning in and look forward to doing more with you guys in the future here.